Hey everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. I'd love to show off a great case that we just finished. This is an example of early treatment, or what we call phase 1 treatment. And there are specific goals in phase 1 treatment. So some indications for phase 1 treatment might be excessive crowding of teeth, maybe something that's affecting the growth of the jaws, or something that's preventing permanent teeth from coming in safely. Now, in this case, she really doesn't meet any of those three things. So I wasn't the one really recommending treatment. But sometimes it's really important for the self-esteem of some kids to correct some of the issues that exist. And that's really the case of why we did treatment here. So the family really had some desires. They wanted a more aesthetic smile for their daughter. They wanted to make sure that her overbite, which you'll see in a second, is quite excessive, that the overbite could be reduced. And so they were really seeking treatment for kind of more aesthetic reasons. And look, don't get me wrong, I'm not going to recommend treatment just for aesthetic reasons, but I have no problem treating people because I know how important it is to have a great smile, even at an early age. And sometimes just that boost in self-esteem at an early age is well worth the cost of early treatment. So let me show you a little bit more about Aniley. These are Aniley's teeth when we started, and you really don't see a whole lot that's too remarkable from this viewpoint. You can't really see how excessive her overbite actually is. If you look from the side, though, you can see how excessive that overbite is. So this is quite a distance from the upper front teeth to the lower front teeth, and so this is really the crux of what they wanted to fix. So actually, this can be treated in a number of different ways. But I actually thought that the simplest and easiest way was to treat this with Invisalign. And so, yes, we sometimes do Invisalign on 8-year-olds, and yes, we can have some amazing success with Invisalign with 8-year-olds. So what the Invisalign did was it took these front teeth and it kind of pulled them back. And we also did some work on the bite. We wore some rubber bands while all this was happening, and we can wear rubber bands with the Invisalign trays. And check out the difference of where we got to. So this is where we started, and this is where we finished. So this is a very normal overbite for kids at this age. Again, this is where we started, and this is where we finished. Now, I'm going to go back to that starting photo, and I talked about how really Aniley didn't have any of the major indications for earlier phase 1 treatment. However, excessive overbite, or what we call overjet, can actually be an indication for early treatment. Now, I don't think that's the case for Aniley, but if you have a really active, and particularly boys, with excessive overbites like this, there can be a real risk for trauma to the front teeth. In fact, there's been some really great studies that say that for every millimeter more of overbite that you have, there's an exponentially higher increase in trauma to the front teeth. And sometimes trauma to the front teeth can even mean having the permanent front teeth knocked out and needing a replacement of them. So particularly in active kids, and way more likely in boys, because they're way more likely to have injuries to the front teeth, this can be an indication for early treatment. Again, I didn't really feel like that was the case for Aniley, but her family really wanted the aesthetic benefit here, and so that's why we pursued treatment. I am incredibly happy with where we got to in terms of the overbite reduction. If you see her from the front, we got these next two teeth. We had the space to get them in. We got them lined up, and so this is looking really, really good. And of course, the beautiful thing is the difference in her smile, and you can really just see her smiling big. She's a wonderful girl, and was a really terrific patient with her Invisalign trays. She did everything we asked of her. We completed this treatment in about 1 year, and now what we'll do is we will just watch and wait. We'll wait as baby teeth get lost. We'll wait as adult teeth come in. I am not sure if she'll require any treatment in the future, but any treatment in the future will wait certainly until we have all of our permanent teeth in. And as she's only 9 years old right now, we're still a few years away from that. So congratulations, Aniley, on being a great patient. We love your smile. This is an excellent example of earlier phase 1 treatment. Thanks so much for listening. Take care and have a great day.